I got to think.
Or we can separate, I mean, we can do that.
It's recording.
Oh, we can have more room. It's okay.
Can you chat on the bottom? Yeah.
It's okay. We'll show separation. That's better that way. Okay.
Good.
All right. So again, good afternoon. We are here to discuss our most recent case, which is our first community acquired case in 93 days. Case number 50 was identified through a mandatory pre-operation screening for a scheduled operation at CHCC Hospital. The contact risk level has been assessed and is deemed as a low risk exposure. With that being said, CHCC is a hospital that deals with infectious diseases on a daily basis. And because the patient was seen at CHCC and much more in a sterile setting, the risk of spread of infection is considered low. Nevertheless, as the only hospital provider with the only surgery unit and emergency department in the CNMI, the CHCC recognizes the need to provide assurances to our personnel, even if the risk is low, to ensure that even their own families are confident in our infection control practices. CHCC has identified 10 personnel, 3 providers, 5 RNs, and 2 NMC nursing assistant trainees as having close contact with case 50 and have been quarantined and are being monitored. To ensure this peace of mind for the employees, their families, and our patients, we instructed these personnel to self-quarantine in the event that they aren't able to separate themselves from their families. They're able to quarantine at the designated government quarantine facility. Our contact tracing team is continuing to investigate the links of how case 50 was exposed. Per CHCC policy, all patients scheduled for surgery undergo PCR swab testing. A negative test doesn't mean they are COVID-free when at the OR table. That is why we don't rely on that alone and the preventive measures already in place to be more effective with preventing transmission. With adequate personal protective equipment and facilities modification to enhance infection control measures, the CHCC has been able to resume elective procedures much needed for the community. Please keep in mind that we must maintain patient privacy during the question and answers. I have with me, Dr. Beth Conan, who's our acting Chief Medical Officer right now, and then we have Lee Tenori as our PIO, and then of course, Mr. Juan Villagomez is our COVID Task Force Chair. So we're ready for questions. Yeah.
Let's go ahead and start off with Justine. If you have any questions, you're on.
Actually, all my questions I forwarded to you. Do you want me to just ask them now?
No, if they haven't been answered, unless if you don't have any other questions.
With our statement?
With our statement?
Oh, yeah, I don't have any questions from the statement. Yeah. But I guess my first question would be, since like the 50th case is from the community, and should the CNMI face what Guam is facing now, is there a possibility that the CNMI will undergo lockdown anytime soon?
So CHCC continues to emphasize the 3 W's, right? I mean, that's always been our messaging since day one. You know, wear your mask, wash your hands, and watch a distance from 6 feet apart from someone else, right? And that's been our messaging. In regards to the lockdown, we have not recommended that at this time.
Okay. And yeah, that's all at the moment. Thank you.
Thank you, Justine. We'll go ahead and go with Laura Lynn.
Hello, good afternoon. In regards to this 50th case and the contact tracing, could you walk us through the contact tracing for this case and how many individuals have been identified in the contact tracing so far? And what are the public places and business establishments where the 50th case patient frequented?
Siobhan, I think you're leading the contact tracing.
Sure. So, hi, Lori. This is Shibroto.
No, that's fine. I can just speak. So thanks for the question. So as you heard from Lee and from CEO, we have identified at least 10 individuals who were as part of the surgery event. And then beyond that, there's been at least 5 additional family members who've been identified as close contacts. We are backtracing this individual's connection to previously identified case, looking backwards to cases identified in early in June and July where there may have been some family connections. So the investigation is still ongoing, and they're continuing to dig and investigate all the possible sources of possible transmission.
So there's no information yet as to where did she get infected?
Yeah, that's a really good question, Lori. It's hard to tell in one specific area where the possible transmission occurred. And so that's why the team is continuing to span out and follow up on leads that we're getting through questioning the family and other members.
Okay. Now that the local transmission reappears in the community, will there be a recommendation from CHEC about mandatory testing for everyone? Or what's the CHEC's recommendation at this time?
So that, yeah, no, the answer is no. That is not how the testing works. We don't test blindly. We are identifying individuals based on our risk assessment. And that's how we're going to manage this by looking at the doing a risk assessment of case number 50.
Mm-hmm. That's all. Thank you.
Thank you too.
Thank you, Laura Lynn. We'll go ahead and move to Thomas. Thomas, you there?
Hi, good afternoon. I just wanted to follow up on what the scope of contact tracing looks like, given what Shaberto just said about it being linked possibly to another case. Has there then been community spread all along?
Yeah, that's a great question, Thomas. I think, there's a lot of unknowns here. My gut feeling is that no, we have not had community transmission because we would have seen it, appearing at our hospital. I feel that our ability for individuals to get testing at CBTs that we've offered has provided us more coverage and percent testing than probably anywhere in the country. So as far as ensuring that we have closed or continue to have a closed handle on potential community transmission, I think we're doing the best that we can do. As the data shows from our dashboard and information that you have at hand, our biggest risk is the borders. And as documented from today, as you have been notified of 3 additional cases that were identified rather rapidly through our fabulous laboratory team from today's flight. But that doesn't compare, with the challenges neighboring Guam with almost 40 plus cases identified today. So strengthening and protecting CNMI is really rooted in protecting the border.
And I wanted to also ask for clarification on the pre-operation screening. So this individual was negative upon pre-operation screening and then tested positive after operation. What was the exact timeline there?
No, the person was identified as positive from a pre-op screening.
But they did not go they did not undergo the operation?
No, well, we want to, I think we don't want to talk so much about the case in regards to, we want to respect the privacy of the individual. So it was a pre-operation screening and the person went through surgery and which is still within our policy about whether or not, even if a person presents as positive, moving forward with the surgery is not unheard of.
And just to clarify rumors that are spreading then, the test was not misread, was it, before operation happened?
Misread is not the word we would use. Did you want to comment on that? Or? No.
We have an internal checking system, and the internal check showed that that person was positive. The surgery wasn't a high-risk surgery. The person wasn't a high-risk person. We didn't put them at more risk. We didn't put us at more risk. It was just a delayed diagnosis.
Can you clarify what that means? I feel that if community members hear delayed diagnosis, it might be a little alarming.
Well, again, you know, as I mentioned earlier, you know, an individual who's pre-screened for COVID before surgery may come as negative. But when they are on the OR table, and this usually takes 48 to 72 hours before the procedure is actually performed. So an individual who's on the table may not be COVID-free, even though they were tested and done the pre-screening, right? So again, you know, for the test to, it's a point of time testing. So we know about the positive situation, and we've went ahead and did a contact tracing immediately as soon as we were informed that this case was positive. It would not have, let me just kind of clarify, it would not have made the final decision whether or not the surgery was going to move forward. That was not the determination for the surgery to move forward. Just wanted to clarify that. So does that make sense?
Yes, thank you. And I wanted to ask about the staff at CHCC then. Aside from the folks you mentioned, are more testing happening at CHCC?
No.
And
again, yeah, we have not identified a high risk after doing a risk assessment, we have not identified anyone else to be tested.
all right, thank you.
You're welcome.
All right, so we'll just continue on. Thank you, Thomas, and then we'll go with Sally in KSPN2.
Hi, good afternoon, everyone. Can I just ask, is this individual asymptomatic?
Yes, asymptomatic.
Okay, so has this person gone off island like during or the past few months, or has this person in Saipan full time?
Sorry, Sally, you're breaking up, so I cannot try to. There has been no travel history determined.
All right. Has your investigation determined any link to the first positive cases in the CNMI?
I believe Shiboto did answer that. You can.
There's no link to the first case, no. There are possible links or a link to an additional case, but not to case number, our initial index case.
I would add that the investigation takes time. You have to talk to lots of people who speak lots of different languages, have to see where they've been, who they've been around. Sometimes people are either not remembering or reticent to say things because they think they'll be getting people in trouble. Yes, this came out of the blue in some ways that we don't know where it came from, but we're trying to track. We've had a lot of people coming in. The test isn't perfect. There could be someone out there who tested negative who actually has the virus, and we haven't seen who they are. But this does not seem like any huge cause for worry or alarm. We're still wearing our masks. We're still washing our hands. We're still social distancing. All those things keep us safe. So if you still have safe practices, you should be safe. Yep.
All right, thank you. That's all my questions for now.
All right, well, we appreciate everybody's time. If there's any other comments to be made, we'll go ahead and
Yeah, I mean, again, the message is just like Dr. Conan said, continue to please continue to practice that, you know, and be safe out there. Yeah.
Sorry, excuse me. I actually have a question. It's about
Go ahead, Justine.
okay. It's about community-based testing. So it's scheduled to stop tomorrow, I believe. Is there any particular reason why community-based testing is yeah? being stopped?
It was included as well on the press release that was released out that it is suspended until further notice based on our Korean Soldier team who have been assisting us for the last 90 days to kind of get these test results in a timely manner. So they'll be leaving on August 20th. So hence the suspension till further notice.
Okay.
Right.
Yeah, but yeah, Justin, on behalf of the work that the task force, our governor's authorized representative has been in close contact with Seoul, Korea to replace the 6 that will be returning. We are meeting with CBP, Custom Border Patrol, as well to coordinate and expedite the recruitment of the individuals, and to make sure that we don't prolong the efforts that we have been doing. Thank you.
Thank you.
All right. There's no other further questions. We just want to strongly encourage everybody again to just practice the 3 Ws, stay safe. If nothing further, we're going to end this call.
Thank you, guys.
Thank you.
Thank you for